Bladder cancer is a very prevalent condition I treat in my practice, and I see a disproportionate amount of bladder cancer in North Georgia.
Bladder cancer is the second most common genitourinary cancer that urologists see.
There will be 58,000 new cases of bladder cancer diagnosed this year.
Occurrence, male versus female, I would tell you that it's probably going to be 50-50. The age group used to be around 65 to 70, but now, for whatever reason, we're seeing younger men and women with bladder cancer. The majority of bladder tumors that we see are probably in smokers. Now, smokers don't like me to say that.
In fact, cigarette smoking will have an increased risk more of bladder cancer than lung cancer, which is not a fact many people know.
But the thing about it has been shown that the urine in smokers has a substance in it that you don't see in non-smokers. And the thinking is that substance may be carcinogenic.
Although quitting smoking will not take your bladder cancer risk down to the level it was if you were never a smoker, there's increasing evidence that quitting smoking and continuing not to smoke for several years will lead to a decreased incidence that approaches that of people who never smoked.
A lot of people get concerned when they see some blood in the urine, and rightfully so. There are several things that we do as urologists. One is to check a urinalysis, which I do myself in my office. One may look in the bladder with a cystoscope, but the main thing is one should not be frightened, because even though bladder cancer may reveal blood in the urine to begin with, basically not every woman or man who has blood in the urine is going to have cancer.
Occasionally, voiding symptoms, which we call irritative voiding symptoms, such as going to the bathroom frequently or with urgency or with burning or getting up several times at night, will be the first tip-off. The diagnosis is made definitively by an office procedure called cystoscopy, where the urologist looks in the bladder after instilling a local anesthetic. If there is a growth in the bladder, then surgery is then performed to confirm the diagnosis. The pathology then determines the next treatments, which are very broad and include one-time chemotherapy, immunotherapy, which is a bladder cancer vaccine, further surgery, and sometimes radiation or chemotherapy.
My advice to someone, man or a woman, if they do have some blood in the urine, don't panic, but either see their local physician or the emergency room or consult a urologist. But blood in the urine is the #1 tip-off and should be pursued by a urologist.
At stage 2 disease, the survival is only 50% at 5 years. So stage 1 disease, which is when we hope to catch the disease, survival rates are much higher.
Probably 75 to 80% of bladder cancers can be detected early on and taken care of. One thing you have to worry about is it going to the lymph nodes and then showing up in bone. Bone metastasis is common in delayed detection. Suppose someone does have a bad bladder cancer and it's through the bladder muscle wall. You can take the entire bladder out, which is called a cystectomy. Several things have been done in the past, and probably the best procedure, and I've done this, is take a segment of a small bowel, and the ureters, the tubes that drain urine from each kidney, you plug into that segment of bowel and make a little pouch. I've had patients that live a normal life knowing they had to have their bladder taken out to survive, and they don't like that at first, but they realize they're still alive 20 years later, and they don't mind the device that collects the urine.
If there's anything I could tell my patients, or I continue to tell my patients, is to give up cigarettes, not only to prevent the risk of lung cancer and heart disease, which is well known, but also to reduce their incidence of bladder cancer.